Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, March 1st. We invite you to submit your questions via Facebook at any Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great, thank you.
In the United States, yesterday, there were 28,434 new cases, with our 7-day average at about 34,460 new cases, with a 12% decrease over the last 7 days. Hospitalizations have decreased by 8%. The deaths have increased by 4%, with our daily average being about 445 deaths per day. In Illinois, the last reported was February 23rd, in which we saw 11,069 new cases, with hospitalizations increasing by 1%, and fortunately, the death rate decreasing by 46%. Okay, so what can you tell us about what these numbers mean, and why is it that the death rate is slightly increasing right now?
Yeah, Sophie, great questions. This is the kind of natural evolution of the end of the pandemic phase, in that you have a blunting of the number of cases, even though they're grossly underreported. Because remember, most people are getting tested by home tests now, and they're not reported. So this number, that you're reporting. I mean, it's a real number, but it's missing more than it's reporting. Okay. However, the hospitalization rate is a pretty hard figure. The hospitals test everybody when they come in and they report them. And that's because they're using a CLIA certified laboratory in their hospital, and that's a mandatory reporting. All right. And then, of course, the deaths are also reported. We know the death rate over the last many decades, and if there's like a difference from prior years, you can make certain assumptions. So what's happened is the case rate not only has gone down, but the hospitalization rate has gone down. Now, there's really two reasons for that. One is that the Omicron variant is less severe. There's probably fewer deaths with Omicron, which is what's floating around now for the most part. So that's one thing. The other thing is the general immunity in the population is blunting the many of the serious consequences of the infection. So that includes everybody that's had the vaccine, everybody that's had the vaccine plus all the boosters. They're doing the best, of course. Everybody that's had COVID. So if you've had COVID, you get some immunity. It's actually, it may sound a little counterintuitive, but the immunity from the vaccine is actually better and lasts longer than from getting an infection. Because getting an infection, some people have a great response, just like a vaccine, but many people have a pretty minimal response. So it's kind of all over the place. Whereas the vaccine is it's dosed and everyone's getting the same exposure. But regardless, you're getting some protection from if you had COVID. So that's good. So so many people have had COVID, and so many people have had vaccines, and then the Omicron is less severe. So the hospitalization rate has gone down from that, and that's going down. But remember, the death rate is the last thing to change, because you get exposed, you get infected, you get sick like a week later. A week later, you get really sick. This is in the people who are getting severe disease. You end up in the hospital within a week or two. You're in the hospital, maybe you get out right away, but maybe you don't because you have all these underlying conditions, or you're just unlucky. And that goes on, and the hospitals treat you very aggressively, and people end up on ventilators and all sorts of stuff. And less than 1% of the people infected overall will die from COVID. So that's why the death occurs so much later than the improvement in all the other numbers. And so right now we're kind of stuck in the 400s. You may remember it wasn't that long ago that it was in the 300s in the early fall. But we're in the low 400s. To put it into context, flu is about 100 cases per day. That's on average over 12 months, but flu only occurs predominantly in 6 months out of the year versus 12 full months. So at the peak of the flu, in the winter, it could be 200 per day, but the average will be 100 per day. Whereas COVID, although we have that typical winter bump, but that's primarily due to the travel that's associated with the holidays, the winter holidays. So, but we've had like the Delta wave was in August, so the COVID doesn't really care too much about the season. It's more about people moving around. We may be stuck somewhere between 300 and 400 per day. So if that's the case, then we have to say that COVID is, 3 times worse than the flu. There's still things you can do. If you get infected with COVID and you have any underlying medical problems, or you're 50 years of age and over, you can take a medicine that lowers your risk by 90%. And that's the drug Paxlovid. And there'll be more drugs coming besides Paxlovid. But right now, it's the only one that really works very well. There's another one, molnupiravir, which works, but it doesn't work as good. So there's things you can still do. And of course, the best thing is, of course, to stay vaccinated and up to date with your boosters. If you've had that new bivalent booster, the one that the newer version of the vaccine that came out in September of 2022, that has a significantly increased benefit. So if you don't want to get COVID, don't want to end up in the hospital, you keep up to date with your boosters, especially this last one that came out.
Wonderful. Well, following with making sure to get vaccinated, Hong Kong is to lift one of the world's longest COVID mask mandates. So what can you tell us about this lift in restriction?
Yeah, well, Hong Kong had a really significant problem. A lot of the, it has an older population. All of China does, Hong Kong included. And a lot of the older people didn't take the vaccine. They didn't trust the government. The government is changing there now. It's becoming more integrated with the mainland, and they didn't trust the people. And so they had this really enormous death rate there, especially in the elderly population. And so they kept going with their mask mandate, very, very strict rules, and part of it's tied to the zero COVID policy of the mainland, but Hong Kong sort of has their own rules. Now, like everybody else, we have to just kind of live with this and admit that we have a new disease that kills 3 times as many people as the flu. And basically, that's what's happening there. They're finally going to list the mask mandate on Wednesday. So it's a big move for them. But China, everyone is loosening up, including the mainland Chinese as well.
Yeah, wow. And going into our second headline is that nasal COVID vaccine shows promise in early clinical trials. So what can you tell us about this?
Yeah, so the nasal vaccine, we have a nasal vaccine for flu, by the way, in people under 50. It's putting the antigen, the little chunk of the virus that's stimulating your immune response, like right into your nose, right into the mucosa of the nose. So it's kind of locally, stimulating the immune system to fight against COVID. And there's a small company called Blue Lake Biotechnology, and they found that it reduced symptomatic COVID infections by 86% for 3 months in people who received it as a booster dose. So it's not just, ultimately you can take it to start out, but right now it's just getting thrown into the pile as a booster. it's a positive result, and this will likely be approved relatively soon. And it already had other nasal vaccines have been approved already in India, Iran, and Russia, probably because they don't have as stringent testing requirements as we do. But regardless, they're already approved in some places of the world. And, they're ultimately it's going to get approved here.
Wonderful. And then the last COVID headline is that the FDA is authorizing first at-home test that can detect both flu and COVID in one test. So, what can you tell us about this? When will this be available, etc.?
Well, this is called multiplexing. So we have the technology now, which was all through basically driven by a big federal program called RADx, the Rapid Acceleration of Diagnostics for Coronavirus 19. And we went from having almost no tests in the spring of 2020 to now over 8 million tests being done per day. Over 100 companies have been supported. Over 50 emergency use applications have been given for COVID testing. There's no shortage of COVID testing now. On the molecular side or the antibody side, the side that, the antigen side, excuse me, the ones you buy in the pharmacy. And you can even buy some molecular tests in the pharmacy. But anyway, we've got tons of tests now. So the new focus is, well, if you've got a respiratory infection, it's not just COVID that's out there. You could have flu. Flu can kill you too. Flu A, flu B, and also respiratory syncytial virus, and there's many other viruses that cause this respiratory symptoms. We never know. Everyone, they are all taking antibiotics inappropriately or whatever. For when you get sick, you call the doctor. I need some medicine. Well, you're just shooting in the dark, because there's so many different things. It can be bacterial, but it's mostly viral, but we don't know. We've been in the dark for ages, and there's really no reason for that. The testing is available, but the companies have never thought it was worthwhile to do. Now with COVID being so lethal, and flu also, that and the other things respiratory syncytial viruses can be deadly as well. The companies have been encouraged to multiplex. So Lucira is the first company that has flu A and B and COVID in one thing. This has been available in Europe already for a few months. And now we have our first at-home test for both of them. So if you have symptoms, it's probably very good to take it. And the newer ones will have 4 or more
Wow.
viruses or bacteria that it can diagnose. So you're going to see that over the next 1 to 2 years, that everything will be a multiplex. There probably won't be any more single-use tests, because let's face it, if you have a respiratory infection, you have one panel of pathogens. You should know what's available, because there are going to be treatments for these other viruses. All right, we already have treatment for flu. And we have treatment for COVID, and the other ones are further behind. But they're not going to get developed until they know how much is really out there, and these tests will really, really help. So it's really going to be a great thing to do this multiplexing thing. It's coming.
Wonderful. And lastly, Dr. Murphy, can you talk a little bit about what's going on with these labs and the leakings, etc., that's going on all over the news right now?
Yeah, so this we talked about this last week, but just to remind everyone, and I'm sure people have seen it in the news, the lab leak theory. So Wuhan has an institute for virology, and they were working with COVID, of course, and it's the Virology Institute. And so, one of the theories originally was that the virus originated in that lab because they were working on it, infected some of the lab workers, and that they started the whole pandemic because they were working with coronaviruses before the pandemic. All right. Okay. So the other major theory is that like almost all the other viral pathogens that jump from animals into man. The COVID-19 virus, SARS-CoV-2, is very similar to the coronaviruses that are in animals in southwestern China, that it very common, very closely related, and they were selling these animals in the marketplace, the regular food marketplace, and that many of there were clusters of cases around there. Now there were a couple lab workers who also got sick, but we don't know where they got sick from, whether it was from the lab or whether it was from the market or somebody they bumped into who had been at the market. We don't know. So anyhow, there have been 2 international investigations that have independent, that have gone over there. Americans were included. And they came to the conclusion that they'll never really know, but the virus looks like the virus that came from the animals. It's not with 100% certainty, but it's with moderate probability. The lab leak theory still remains possible, but it's what they call it's a very low probability. And what happened over the last couple of weeks is that there was an analysis of all the studies, looking at the COVID and everything, and the question just keeps coming up, where did this thing come from? So the last report came from the Department of Energy and the FBI. Now, these are not agencies that are health oriented, So I think the FBI is the easier one to explain, because they were charged to figure out, are the Chinese hiding something? Well, the Chinese, it's a very opaque country. And right now, our relations with China are very bad, and they're not going to cooperate. They didn't cooperate before, and they're not going to cooperate now. They feel like they're just going to, they don't trust anybody, and, they're not open. They really shot themselves in the foot, because if they had been wide open with these investigations, and they did open a little bit, but not completely, we would have known by now. We're never going to know, because it's over with them. It's always just going to be this mystery. The medical people, the Department of Health and Human Services, the CDC, the NIH, they don't believe in the lab leak theory. I mean, because the virus looks so much like the virus that was in the animals. So if you look at the genetics, it fits the Wuhan market. If you look at an investigation by a law authority like the FBI, well, why are the Chinese hiding something? If they're hiding something, there's something wrong there. I mean, it's a mentality. So and so, they're just exploiting that avenue, and but there is no answer here. This is just going to they're going to just keep talking about this and talking about this, and one person worked, they're going to have like anecdotal reports and stuff. We will never know 100%. That's, what difference does it make at this point? We had a worldwide pandemic. I think if you look historically, though, I mean, coronavirus has been around for a long time. We've known it. It didn't cause any problems, so it was hardly studied. And then there was SARS-CoV-1. Remember that? SARS-CoV-1 was lethal in 10% of the people, but it was difficult to transmit. So not that many people, a little over 1,000 people died out of the 10,000 people that got it. But, when 10% of the people died, that's like, a crisis. That subsided. And then, a couple years later, you had MERS, Mideast respiratory syndrome, and that's another coronavirus, and that killed 30% of people, but that was even harder to transmit. So very few people. It's still going on, actually. Just in like 1,000 to 2,000 people or something like that, but a third of them died, mostly in Saudi Arabia. So, you know, the bells should have been going off like, hey, this virus can be nasty, you know. And very few people were studying coronavirus until COVID finally hit. And they said, hey, this thing evolved to the point where it can be, it can be lethal, but only 1% die. But it's easy to transmit. Look how easy it is to transmit. It's super easy to transmit COVID-19.
Mm-hmm.
I mean, it's like measles. It's like incredible. Everybody's going to get it. Everybody's already had it, or almost everybody. So anyway, so this lab leak thing, it's not going to go away. Nothing is going to change. And no one is ever going to really know. It doesn't really make any difference because nobody's ever going to know. It looks like I think we should just prepare for the next organism, virus or whatever, that is going to, you know, cause a big epidemic or a pandemic. I mean, this doesn't really change anything. It just gets everybody all riled up and you know, but it's no new information at all. You know, they say they have some new information. They have some new information. Where is the information? Excuse me. This thing has been studied by so many different people, but be careful who is doing the reporting. You know, the FBI, you know, they think everyone's guilty before they even start. That's why they're investigating them. You know, and you know, the same thing, you know, with the department. What does the Department of Energy have to do with this? You know, like, it's a very strange kind of report coming out there. I don't know. It's really kind of hysterical, but people now, oh yeah, no, it's probably a lab leak. You know, it's, if you even, when you read their reports, that the ones they've made public, it says of like low probability. It's like, they don't even believe in, you know, it's a possibility. Okay. But all right, and that's where we sit. But that's what's going on. Kind of a similar thing is going on also with the data from airplanes. Maybe we could just add this at the end here. And that, you know, it's been reported, and we've reported that, you know, the data from wastewater in airplanes, you know, so over 80% positive for coronavirus. Now, remember, when you do molecular tests, you know, it can be positive for months after a person's infected. So, okay, that doesn't necessarily mean it's contagious, but it means, okay, people that fly, there's a lot of people that have had COVID, but they're not necessarily infectious. But one of the studies, a newer one that just got published, was they looked at the first study to evaluate whether testing people on inbound flights, whether, you know, pre-testing them before they get on the plane, whether that had any benefit. And they found that the pre-testing actually was tied to a 52% lower positivity at arrival in the United States. So some places that come in from high infected areas, they, you know, they get tested at the airport. You know, we have enough of those kind of tests to do that. And if you have pre-testing and don't let those people fly, that drops by at least 50%. So that's good news. It means that's just another mechanism we can use when there's more outbreaks.
Right, right. Well, Dr. Murphy, going into our only viewer submitted question, has there been any decrease or increase in the rates and severity of long COVID due to the newer subvariants of Omicron? What can you tell us about this?
Yeah, that's a really great question. There is a decline in long COVID. And since Omicron appeared, it's the amount of long COVID has dropped by about half. So that's really good news. But there's still a lot of long COVID, but it's half as much. Now, is that because Omicron is less serious, less severe? Or is it just because there's so much immunity. Well, in this one paper from the United Kingdom, they looked at people in the late fall, like in December, and they found that a mixture of people with Delta and Omicron, and the Omicron ones had 50% less likely to have symptoms, I think 3 months later. So Omicron probably is less serious and will cause less COVID. We also know that people who've been vaccinated, they have less COVID, long COVID. So so it goes back to our first story. Omicron is probably a less serious disease. There's less serious disease and less long COVID, and plus the immunity in the population also protects against long COVID.
Wonderful. Well, Dr. Murphy, thank you so much, and we will see you next week.
Okay, see you next week.